Hi, this is Dr. Cordy, and I'd like to talk a little bit about the usual or sort of most common and customary treatment for PCOS in a medical practice, like gynecology or an internist practice or your primary care physician. Typically, when you show up and have PCOS or they help you diagnose your PCOS, you will get prescribed birth control pills. That's the most frequent thing that I've seen come out of those practices. And birth control pills are absolutely a this for that answer. They handle the increased androgen issue. They handle the too many hormones in general issue. Some women with PCOS, they not only have high androgens, they also have too much progesterone. They also have too much estrogen. They have too much of everything, really. And so by suppressing ovulation and suppressing the natural production of hormones, we tend to take care of some of the PCOS symptoms, like some of the acne, some of the abnormal hair growth. And by doing that, when we do that, we also sometimes, for some people, help them feel a little bit better and at least get some of their PCOS symptoms under control. The problem ultimately is that when you take birth control pills, you increase insulin resistance. And by increasing insulin resistance, when someone who's already insulin resistant, if that's the kind of PCOS you have, if that's the driver for your PCOS, is that we will now have an insulin resistant system that we are giving medication that increases its insulin resistance to an even further degree, which is significant and important because we know women with PCOS, if they have metabolic syndrome and this insulin resistance condition, if we don't handle that, their risk of heart disease and other chronic inflammatory conditions goes up with age. And we've not handled the underlying problem. We also have not handled the reason why when they stop taking birth control, they may be completely infertile. And we may never really get to the root cause of the reason why they're overproducing some sex hormones and underproducing others. And so we tend to have really a global deficiency of B vitamins. We have a global deficiency of minerals. And by taking birth control pills, we make those worse, particularly if we're not even supplementing them while you're taking the birth control pills. A lot of people who take birth control pills are happy with their results and they do fine. They're not interested in fertility at the moment. They're not interested in eventually fixing any underlying condition. They're really just interested in handling themselves immediately in this moment, and they work for them. The patients we see in our practice are the patients who are interested in foundationally solving the reason why they have hormone imbalances. They're often interested in future fertility or even getting fertile really soon for pregnancy. And they're also interested in generally handling the underlying reason why they don't feel well. There's so many symptoms with PCOS that go along with high androgens and anovulatory or oligoovulatory cycles that are fundamentally just really uncomfortable. And they're more interested in handling all of those symptoms rather than just suppressing some of the hormones. So it really depends on what you're looking for. If you're looking for that allopathic answer to take birth control pills for your PCOS, that's a very simple thing to get lined up with your medical practitioner, and that's typically the way that you're going to see them handle this. And if you really want to get at the root cause and are more concerned about your future fertility and your future cardiovascular health and your future hormone health, even short and long-term future, we really need to figure out where this is coming from. So understanding which kind of PCOS you have, whether it's the insulin resistance kind, if it's the adrenal kind, if it's the inflammatory kind, or if it's the post-birth control kind, which wouldn't really be part of this scenario. We really need to understand those things before we make a decision about how we're going to help you treat and help you handle your system so that we can start getting you better overall. So I hope this helps. This is a big decision, understanding how you want to handle PCOS, because it's a really complicated condition. But I think this is a piece of understanding the options available for you, and hopefully you can start to put your situation together and understand how you want to take care of it better. Thanks.